At about 3 p.m. here at the Nyarujenje COVID-19 Treatment Center, a patient has just been admitted from Muhima Hospital, unconscious, and his vitals are okay but in need of oxygen. Lately, with a spike of infections across the country, we are told by healthcare workers at this treatment center that such scenes are happening more often, with many patients being referred from other hospitals. During our visit to this treatment center, we visited the ICU where critically ill patients are being taken care of. All beds are full and almost all patients are being aided to breathe by ventilators. Nurses and doctors are seen pacing under their protective garments to ensure that patients are adequately taken care of. It's hot, it's loud, and the work never stops. Even in the most intense and scary moments, though, they don't forget to be compassionate. Away from the ICU, we visit some of the patients that are recovering who share their experience with us.
I was at home quarantine. Then unfortunately my oxygen level dropped slightly lesser. So what I had to do, my management decided to send me here. And here I got one of the best treatments. I was given proper medication and proper care. Based on that, I am feeling better. Now my oxygen level has gone better.
The Nyarujenje Treatment Center has the capacity to receive about 130 patients. But currently, the Director General of the hospital says that in the recent days, the sheer volume of patients with COVID-19 they are receiving is overwhelming.
As we are having an increase of infection in our country, really it is the same in our hospital. We are in this week, 1 week only, we are having an increase from 20% to 83%. And among our patients, we are having 40% who are requiring oxygen.
With the severity of the pandemic now, the decision was made to reopen the Kanyinya Health Center to support Nyarujenje Treatment Center in treating COVID-19 patients. After almost 6 months since the Kanyinya Health Center shut its doors to COVID-19 patients, in the wake of the increase of infections across the country, the health center preparations are underway for the health center to be reopened to support the Nyarujenje Treatment Center that is almost full to capacity. While inspecting the preparations ahead of reopening, Dr. Cornel Nihabose, the head of clinical and public health services in the Ministry of Health, said they're increasing capacity of case management as the country experiences a spike in infections.
But within the Kigali, we've only Nyarujenje, which was operating since January up to now. There's a need to increase also another treatment center. The reason why we are reopening the Kanyinya Treatment Center by bringing again some equipment, some staff, some medical supplies to have a capacity also to start again to have some case management here at Kanyinya Treatment Center. In less than 24 hours, we may support Nyarujenje Hospital to have to receive the first patients, because at the pace we are, the Nyarujenje Treatment Center must have the full capacity, must have the full occupation. The reason why in less than 24 hours, this night or tomorrow, we may start receiving the first patients.
The World Health Organization emphasizes the need for stringent public health measures after Africa has now surpassed 5 million COVID-19 cases.
After 4 weeks of consecutive increases, Africa's third wave is surging upward and accelerating fast. New cases continent-wide are up by nearly 30% in the past week, and deaths are up by 15%. At the continental level, we're seeing a rise in cases similar to the first wave peak in July 2020, and about 50% of the second wave peak in January 2021. So Africa is in the midst of a full-blown third wave. The sobering trajectory of surging cases should rouse everyone to urgent action. We've seen in India and elsewhere how quickly COVID-19 can rebound and overwhelm health systems. Public health measures must be scaled up fast to find, test, isolate, and care for patients, and to quickly trace and isolate their contacts.
On Thursday, out of the 5,770 tests that were conducted in Rwanda, 422 people tested positive for coronavirus, the highest number of daily infections since the first case was identified in Rwanda. Reporting for RTV News, Gloria Mutesi.